It has been an extremely difficult year for our senior citizens, as many have been forced into isolation, away from their family and friends. So anything that can alleviate pain, anxiety, and stress is so incredibly needed. Debbie Mason is the president of Tidewell Foundation, and she joins us via Skype to talk about how music can make a major difference to someone who is suffering. Thanks for joining us, Debbie. Happy holidays.
Happy holidays. Thank you.
So for anyone who is not aware, let's start by having you remind us what Tidewell is all about.
Tidewell is the community's not-for-profit legacy hospice and palliative care provider. We've been in the region 40 years, providing comfort, care, and compassion to more than 1,200 patients a day. And we go to them wherever they are, in their homes or retirement centers and more.
Okay, so part of going to them is obviously about making them as comfortable and happy as possible. So tell us about your different types of therapy offerings.
Beyond the medical and clinical care that we provide, an important part of what we offer patients is in a bucket called complementary services. And those things include massage therapy and Reiki and music and art therapy. And they are things that allow patients to have calm and peace and reduce their pain. And they also are often bridges to connecting patients with family members.
Yeah, let's talk more about those bridges. How does music sort of wake a patient up or bring out past memories that I'm sure can certainly make family members be happy as well?
Music is an interesting tool because it actually is shown as people are listening to music to block neurotransmitters that create pain. So when the brain is actively processing music, it allows the right side of the brain to create images and feelings of peace, and that helps the body release endorphins, which then reduce pain and promote relaxation. Well, there's even some connections for people with Alzheimer's and dementia too.
Well, which makes sense, right? Because we all have those, maybe songs from our childhood or songs from different stages in life that can reawaken those memories. It must be so important to the family when that gets shared with them.
Right. So imagine you're a family member with a patient who has just been non-responsive for a long time because they're in the final stages of dementia or Alzheimer's or some other type of disease that kind of shuts them off from being able to connect with family. Music can be that bridge. Finding out someone's favorite song during a beautiful moment, during their 50-year marriage, that music can open the door to allow the family member to connect with the patient.
Absolutely. And I understand since you've really incorporated music therapy a little bit more into the program, it's been very popular. Tell us about that and the requests.
It has been. We started with one music therapist and now we're up to 3, but it's the most popular request we get because there's more and more data out there to show how music is that bridge for families and that our certified music therapy program is connecting people in an incredible way.
Well, and especially in a situation too where it probably feels like it is hard to connect with a family member. If nothing else, music can certainly make it fun and a little more relaxing for the family.
Exactly. And the other thing we're finding is even if the family member can't be in the room with the patient, so we're doing this over Zoom because it's not safe for the family member to be with the family, or maybe they're far, far away, sharing that musical moment, even across technology, allows families to just reconnect and rebridge around happier times.
Oh, listen,
music is true memory.
Anything this time of year and the way this year has been to be able to have connection and closeness for people who are separated from their families. I know that's so important to anyone. Now, you mentioned that you were hoping to get more musical therapists. Quickly tell us how Tidewell is financed and how people can help.
Well, all of our complementary services are 100% supported by donor funds. If anyone's interested in helping us expand those or our community other grief services programs, they can go to tidewellfoundation.org. make a contribution or connect with us about their dreams and visions of helping more families in our region.
Oh, that is wonderful. And I do want to reiterate to everyone that services like musical therapy are free of charge to your families. And that is absolutely wonderful. What a great holiday story, Debbie. Thanks for sharing. You can visit tidewellhospice.org to learn more about all of their different programs, including music therapy. And you might want to check out their home holidays page for the treat of hearing some of the music that Tidewell therapists and volunteers have recorded. We'll be right back.